your child the meaning and importance of social distancing. Also reassure them that it's for their own benefit and for those around them, especially older family members like their grandparents.
Share with them how you deal with your own stress so that they can learn how to cope from you. Limit your family's exposure to news coverage, as children may misinterpret what they hear and can become frightened about something they do not understand. Try to keep up with regular routines. Create a schedule for learning activities and fun, relaxing activities. Take breaks, get plenty of sleep, exercise, and eat well. Deal with the COVID-19 calmly and confidently, as children in part react based on what they see from the adults around them. This is a message from the Ministry of Health.
How to put on and take off a mask. Wash your hands with soap and water for at least 20 seconds. Dry your hands with a clean paper towel and throw the paper towel away. Check the mask for any defects such as a tear or missing tie or ear loop. Throw away any that are defective. Make sure the exterior side of the mask is facing out away from your face. Place the mask completely over your nose and mouth. If the mask has ear loops, put those on top of each ear. If the mask has ties, pick up the mask by the ties and tie the upper ties behind your head with a bow. If the mask has a lower tie, then once the mask is fitted to the bridge of your nose, tie the lower ties behind your head with a bow. Make sure the mask is completely secure. Make sure it covers your nose and mouth so that the bottom edge is under your chin. Wash your hands again with soap and water for no less than 20 seconds. Removing the mask. Wash your hands before removing the mask. Do not touch the inside of the mask. It may be contaminated from your breathing, coughing, or sneezing. Untie or remove the ear loops and remove the mask by the straps. Throw the mask in the trash. Wash your hands again to complete the removal. Note, cloth masks block some but not all airborne coronavirus. Social distancing and frequent hand washing are still your primary protection measures. A health and wellness message from your Ministry of Health.
In response to COVID-19, the government of Belize has implemented strict guidelines on persons to practice social distancing to reduce the spread and risk of getting COVID-19. Practicing social distancing is when one maintains a greater than usual distance away from another person. In public health, it is a practice to prevent sick persons from coming in close contact with healthy people. Recent studies are showing that social distance of 3 feet or more decreases the exposure of COVID-19. Before these restrictions, a person with COVID-19 could infect 2.5 persons in 5 days, 406 persons in 30 days. When you put into practice measures to reduce the exposure activities by half of that one infected person, in 5 days you would possibly only infect 1.25. 30 days, 15 persons. Reduce the exposure of that infected person by 75%. In 5 days, you infect 0.625. In 30 days, 2.5 persons. Remember, the virus does not move on its own. People move it. The more space between you and others, the harder it is for the virus to spread. A health and wellness message from your Ministry of Health. If you have been directly exposed to the new coronavirus or have a history of travel in infected populated areas, it is recommended that you self-quarantine. Identify a room to be used to self-quarantine and limit contact with healthy persons.
Now?
Keep away from older persons and persons who have medical conditions that affect the immune system. Monitor for any cold or flu-like symptom for up to 21 days and wash hands frequently with soap and water. If you become seriously ill, call your healthcare provider or 0800 664 2273 for guidance. A health and wellness message from your Ministry of Health. Persons at risk of becoming seriously ill from the flu or the coronavirus. People over the age of 60, persons with medical conditions they already had, such as diabetes or heart disease or conditions that has made their immune system low, such as HIV or cancers. At this time, there is no vaccine or treatment. Serious cases may need oxygen or ventilator support. Be caring and show support for your elderly loved one during this time. A health and wellness message from your Ministry of Health. Reduce your risk of viral illness like the flu or the coronavirus. Wash your hands frequently with soap and water or with an alcohol-based hand sanitizer. Cover your nose and mouth when coughing or sneezing with a tissue. Throw away, then wash hands immediately. Avoid close contact with anyone who has the cold or flu-like symptoms. If you become ill, please visit your doctor or nearest health center and share your travel history. A health and wellness message from your Ministry of Health. Get information from a respectable international or official local source. When in doubt of COVID-19 information, verify before sharing or repeating the information. Prepare for COVID-19 with an easy plan of action for yourself and your family to put into practice to avoid or reduce the spread of the illness. Be calm and continue to stay informed of the developments of COVID-19. Adjust your plans where necessary based on official advisories. Your local health authority can provide the best information on whether COVID-19 is spreading in your area. If you become seriously ill with cold or flu-like symptoms, please contact your doctor or nearest health center. For more information, contact the Ministry of Health at our toll-free number 0800 MOH Care or through our Facebook pages, the Ministry of Health Belize or the Office of the Director of Health Services. We are here to help you. A health and wellness message from your Ministry of Health.
Border jumping is illegal and puts our entire nation at risk. Our neighbors, Guatemala and Mexico, are experiencing rapidly increasing numbers of COVID-19 cases, and there are more deaths every day. Persons entering Belize illegally from these hotspot countries are not being tested for COVID-19. That's why it is important to report anyone entering Belize illegally by calling our hotlines. Smart users call 0800-JUMPERS or 0800-BORDERS. For Digi, call 0800-SAVE-BZE. Condoning or engaging in border jumping is putting yourself, your family, and the entire country at risk. Remember, anyone caught will be fined up to $5,000 and or imprisoned for 2 years. Stop border jumping now. This message is brought to you by the Belize Police Department and the Belize Bank.
Saltar la frontera es ilegal y coloca a toda la nación en riesgo. Nuestros vecinos, Guatemala y México, han experimentado un rápido incremento de casos de contagio de COVID-19 y hay más muertes cada día. Personas entrando a Belice ilegalmente, viniendo de esos países con múltiples casos, no les están haciendo las pruebas de COVID-19. Es por eso que es importante reportar a cualquiera que entre ilegalmente a Belice llamando a nuestras líneas directas. Para Smart, marque 0800-586-7377, 0800-267-3377 y para Digi, marque 0800-728-3293. Tolerar o participar en entrar ilegalmente es ponerte a ti, a tu familia y a todo tu país en riesgo. Recuerda, cualquiera que sea arrestado deberá pagar una multa de hasta 5,000 y o prisión por 2 años. Detén el salto de fronteras hoy. Este mensaje es presentado por el Departamento de Policía de Belice y el Banco de Belice. El contrabando es importar ilegalmente productos como el alcohol, tabaco, comida y objetos. Aparte de romper la ley, los contrabandistas están poniendo ahora en riesgo la salud de los beliceños. Ellos arriesgan traer coronavirus a Belice por medio de sus contrabandos. Para mantener el COVID-19 fuera de Belice, todos...
Okay, good afternoon all. Well, first, before I think we get started, I want, before anybody asks me why I'm not wearing a mask, well, I am in a room that there's physical distancing happening. Everybody else in the room is wearing a mask and nobody else is actually speaking. I think I can say I'm a little bit delayed because I was screened before I came onto the set. But let's get, because there's a wealth of information that I think needs to be shared. I'll go quickly. I think people are more concerned with data, but I'll save a piece of the data towards the end so that I think we can get all the messages that we need to get across. I won't go through all the particulars of data prior to the last live feed that we attempted on Saturday. But just so that you know, as a brief reminder, that on Friday we had done 32 out of 214 tests. That's a percentage of 14.9% of the samples. On Saturday, we only were doing the follow-up on the samples that were screened through Friday. So we got 7 out of 14, that's 50%. On Sunday, when there was validation, calibration, and extraction of samples that had started arriving from Friday, Saturday, only 3 samples were processed, and that's 33% rate. Through the weekend, we have started using a different template, not only the traditional PCR template that can run 90 samples in every cycle, but it's a gene expert Cepheid template that can give you 4 results every 30 minutes. We have 2 PCR machines that are working, and there's a third machine that is being set up so that you will have 3 PCR machines at any given point in time. So what has happened this week is on Monday, we screened 23 positives out of 144 samples. That's 15.97% rate. One of those samples was in Corozal, 2 in Oranjewak, the first case for Kikaka, 5 cases in Belize City. 4 of those are linked to clusters out of San Pedro, and 1 unlinked. The remainder of the cases were in San Pedro. On Monday, you also saw us give out a release in terms of the active clusters we were following out of San Pedro. We had 1 case of the cluster in the church that we had to name, where we had been told that up to 40 persons could be having minor signs and symptoms. So those are part of the screenings that was done through the weekend and earlier in the week. So that's 1 cluster in San Pedro. The second cluster that now linked to patient number 57. You will also note that when we published that press release on Monday, we had said activities related to whatever may have happened at the Allure nightclub. We couldn't really specify the day, and I'll come back to that right now as to why we went to a specific time frame and why that specific nightclub. And the third cluster, which has implications for a national concern, is the fact that we started seeing 2-3 samples start to turn out positive from a construction site in San Pedro. And we had been following what was going on, and we were made aware that people had actually started leaving the island within 24 hours of having identified patient number 57. So because people said what would have happened if a lockdown had been instituted, well, people actually left on the Monday. We diagnosed and made the case the previous Sunday, and the following day you had people leaving that construction site even when there was no notion or anticipation of a lockdown. So that was a cluster that we felt had implications, because a vast amount of the officers would have gone primarily to villages in the north, but they spread out across the country. You had some people also in communities such as Sokots and other communities in the Cayo district, but primarily to the northern communities, and there's a long list of villages in that list. And coming back to the cluster, once we start reviewing the data, and that happened, I mean, it's reviewed daily, but Saturday and Sunday, when we start making the link, by Sunday, we had known that there was a common denominator that we found in the samples that had turned out positive from San Pedro. 42% of the cases that had been identified by Sunday in San Pedro had a common denominator, and that is a nightclub that is named in that press release, having been at that nightclub around the period that we suggested, which was July 16th to the 19th. So I think it's important that we had to specify where the hotspot may have been. So on Tuesday, that was yesterday, we had 33 out of 84 samples that were positive. That's 39.3% of the samples tested. 31 of those were in the island of San Pedro, and we have 2 other cases that of course become of immediate concern outside, once they are outside of San Pedro. Not that we are not concerned about the cases in San Pedro, but the implications it may have for spread outside of the town of San Pedro. One of those cases was identified in Belmopan. That's a patient that's hospitalized. I'll come back to that right now. And the other is a person in Belize City. Both of those cases outside of San Pedro were linked to an already identified case. So we could not establish that there were people outside of that specific group. Then it's all linked again back to San Pedro. In terms of what has happened with hospitalized patients, we still have 1 patient hospitalized in the Northern Regional Hospital, and the patient that was at the Western Regional Hospital, from yesterday we had been made aware that she was having progressive respiratory distress, because we have been asked how comes the patient is not being managed in Western Regional. Well, we don't have a ventilation system. We have a non-invasive ventilator at Western Regional, but because she was anticipated that she would have required ventilation support, she has been transferred to the Carl Hirschner Memorial Hospital because she's critically ill in respiratory distress. So we do have 1 patient now admitted at the ICU at the Carl Hirschner Memorial Hospital. One other situation that I think is of pressing concern, and I chatted briefly with some members of the professional associations before I came here, is that we are required to report to global figures every day the healthcare workers that are ill, that are having COVID-19 symptoms, and that's for a variety of reasons. The total figure you have now of healthcare workers is 10. We have 10 healthcare workers that have turned out to be positive, and 1 person who works in administration in a health facility. Out of the 10 healthcare workers, you now know that 1 person is an employee of Carl Hirschner. 6 persons are in the private sector, and 3 persons are in the public sector. Out of this, in the public sector, we have 1 pharmacist, 1 doctor, and 1 nurse. As I had stipulated before, in our contact tracing, we have not been able to identify that any of these 3 officers would have gotten infected in the actual line of duty at work. And it's important that we stress that, and I'll see why that has implications as we move along. And I think it has implications for obvious reasons that we will all be aware of. 1 doctor at Carl Hirschner, it would not seem from the initial contact tracing that has been done that he would have been infected in the line of duty. And as a matter of fact, the reason why he was swabbed is because he was linked to a previously identified case. So I think we need to stress that. And in terms of the 6 health staff outside of the healthcare, the public sector, then it's in private sector. We have 1 lab technician, 1 pharmacist, 2 nurses, and 2 doctors. Of course, the contact tracing in those elements continue, but it doesn't seem that people from the health sector would all necessarily be infected at work or in the line of duty. The last check I have, we also have 1 Coast Guard, and I think I had 6 or 7 police officers that have also been infected, not necessarily in the line of duty. Where we are going also, because we have been asked consistently where can people go and get tested, and even some professional bodies have asked where we can go and get persons tested. I think we need to stress that we are still not doing routine testing, which means people cannot just show up at a health facility and ask that they be tested for COVID-19. We are still doing, in as much as is possible, contact tracing where there is no community spread. I need to stress and emphasize this because we are now being questioned how comes we stopped doing contact tracing in San Pedro. If we go back to what we had said in March and April, and this is what every country is doing, is once you have established community spread, you will understand that there is no real need to be doing contact tracing. You have basically just detecting the cases, and primarily what you want to do is contain as much as you can so that the health system is not overwhelmed in terms of number of patients that are showing up either to be hospitalized or requiring some level of ventilation support. So contact tracing outside of San Pedro is happening. It happens in Corozal, it's happening with the cases in Belmopan, with the case in Dangriga, with the cases in Orange Walk. For some elements it's easier than others. For example, in Shipyard there's one cluster of 11 or 12 persons. All of those persons are one single family, so that contact tracing is much easier than in other areas. The issue of ventilators, yes, Carthus does have 6. There are 6 ventilators here. Well, 3 are on their way now to Carthus, and by this Friday they would have the ability to have set up 12 ventilators. But this is where I want to also go back to underscore the fact that even if we have 20, 25, 30, 50 ventilators, or all our COVID-19 beds have a ventilator, we have to also understand what our health system has to offer and our challenges in terms of human resources. Now, why am I saying this? Is because we have 2-3 intensivists in Belize City, no intensivist that's doing intensive care work outside of Belize City. So even if you have 20, 25 ventilators in your referral hospital, you don't have intensivists that are going to be managing that. Granted, you may train internists, and I think that's part of the process that has been ongoing, but you're still not going to have enough. I think we checked this morning with Deputy Director, and we may have less than 10 Belizean internists spread out across the country. So having an ICU bed with a ventilator is not as easy as just setting up a ventilator. You need staff. You may need up to 2 nurses per ventilated patient in an ICU, and then you have to talk about shifts. There are 2 or 3 shifts. So it's not as easy as just setting up a ventilator and assume that is going to solve necessarily the problem. And that's why we have been heralding our response around good public health measures, because what you want to do is contain those cases before they actually go and overwhelm your ventilation capacity that you may have. The other thing in terms of ventilators, because we have noticed a trend that's starting to go on where people are saying, well, once you hook ventilation is what is accelerating your mortality rate. Actually, no. I want to dispel that myth rather quickly, because that is not so. Once you're hooked up to a ventilator, is because you are critically ill. Outside of the COVID context, whoever has been around a ventilated patient, you know that you can be placed in a ventilator when you have cardiac failure, when you have sepsis. Once you're hooked up to a ventilator, your probability of surviving decreases. This is not only related to COVID-19, related to any other health condition under which you may require ventilation support. So of course, the person who is hooked up to a ventilator is critically ill. Your probability of surviving that minimizes as you move along. And the longer you stay hooked up to a ventilator, the lesser your survival rate can potentially be. So let's not get caught up into the situation where people are blaming ventilators for the demise of any patient. In terms of the two patients hospitalized, I think it's important to stress, I believe one has 61 years and the other person is 71 years. And that we want to stress that because we had pushed out an infographic again to stress that they are more vulnerable population. So we really need to start taking this seriously because the younger generation of populations who may be the ones partying all over and being the spreaders might not be the ones who are critically ill. But once our older generation, diabetics, hypertensive, obese persons start to fall ill, then you will understand we can get into serious problems rather quickly. So that's two. We also know that there's some trend where people are trying to minimize the use of masks on our pages, or people minimizing the use of PCR testing, or why we are doing testing, that we should not be testing anybody. Those we are not, at least on the Ministry of Health web page, social media pages, while we respect everybody's opinion, myths and opinions that go against what established science has proven are not going to be accepted, and we will proceed to ban those comments and those users, because we really cannot be caught up in that situation where people are just minimizing a pandemic. The other situation that our staff is facing, particularly we had this incident in Cayo and Corozal, is that we have people from private sector and from some public offices where banks, teachers have decided to put their staff on quarantine because they are either a secondary or casual contact of a known case, and so they have decided to send these people home. If any employer decides to send people home without informing the quarantine authority, then you cannot anticipate that 2-3 weeks later you will come back and ask us to sign the sick leave form for the staff that you decide to send home. Because if not, then we will pretty much have 50% of the working class simply not show up to work maybe next week Monday. Because this is an increasing concern that's starting to pop up everywhere, where employees are just sending staff home. The other is that employers are sending their staff home and demanding that they get a test, and they cannot come back to work until they bring a test, even if they are symptomatic, based on suspicion that they may have been in San Pedro or that they may have been with somebody who was in San Pedro. It does not necessarily work like that. And the fact that your employer has sent you for a test is not going to necessarily proceed. There's a process and procedure as to how we're going to go about doing that. And it's happening even at headquarters. We have had that incident go through. Rapid tests have not been validated for use in the general population. We have just done the validation of one test for a specific purpose, and we said for populations that are coming and are going to the safety corridor. We have not anticipated that everybody else is going to be using rapid tests. We are also aware that in private sector, they are able to do PCR tests or swabs, provided that there's a situation where people require that, and those tests are routinely going to be sent to the Ministry of Health for processing. The Ministry of Health is not charging a fee right now for any of the PCR tests that are being done, regardless of where they come from. We need to really specify that, because people are asking whether there's a cost, or whether if they pay they can get their sample processed quicker, or whether if they go to private sector, whether if they pay for that, whether a sample will be turned back quicker. We are not doing that for the time being. The other situation with people leaving, I know that students are leaving and medical persons particularly going to Guatemala, are being asked to turn in a PCR test. By the end of this week, we should be able to specify under which day of the week we will be running such tests and under which platform, because you will understand that our lab is churning up all those contact tracing results in the first instance. So I ask that you bear with us until we decide what platform we're going to use for the PCR test that people are requiring when they leave. Where possible, we are giving people a medical report that they are asymptomatic and that they can leave with that, and sometimes it has worked without necessarily getting a PCR test. Hydroxychloroquine, I know we were asked about it because it's appeared on a list of donated medications from the government of India. I have checked with the lab, with the central medical stores. On that list, not all the supplies have arrived. So hydroxychloroquine is not in country. But again, you go back to the data and you will appreciate that there is no real hard scientific evidence that puts hydroxychloroquine atop other medications. So no real significant benefit in its use then. That's what I think I have in terms of notes. I do have some other information that I will share with you towards the end, and maybe after I go through the questions I can say some of the things in Spanish as we move along. And I'm assuming there's going to be lots of questions, so I hope that this clears up part of my other notes that I already have. In terms of test kits, we have continued to receive those. I believe we are now at 21,000 PCR tests, and further items are coming in through UNICEF for specific populations. And in discussions with Dr. Jack earlier, we would have gotten a note that there's a potential to get more reactions as well. Why we use RT-PCR when the FDA has not approved the PCR? Well, I don't know what the FDA has approved in that light, but we do know that PCR testing remains the gold standard for SARS-CoV-2 everywhere in the world, and that's without getting into virology classes as to what it's specifically detecting. That's the gold standard. You can go and review that literature anywhere. Of course, you're going to find people that produce pieces of data that doesn't necessarily support that theory, but that is the fact. It is the gold standard. That's that. Why was the patient transferred from Western Regional to Carl Hughesner earlier? I have said that the patient was having respiratory failure, anticipating that they would require ventilation support, and that's the reason why they were why the patient was referred. This is an elderly patient. The Western Health Region is equipped to handle critical matters, but just like with any other patient, once they are not able to handle that, they don't have an intensive care unit, those patients go routinely to Carl Hughesner. The same referral process as with any other disease is what is being followed, and that's what was done with this patient. It says, so many test kits are in the country for over 250,000 citizens. I already just said we have about 21,000 PCR tests. People saying it's hard to get tested in San Pedro. We are, as I said, clearing up symptomatics. Most of the samples that were processed on Monday and Tuesday and today in the first batch are from San Pedro. So that's important we say that. Ventilators, 9 should be set up by the end of today. I think we also need to clarify something that we did say in March. Recall that before the COVID-19 situation, Carl Hughesner was the only entity ventilating patients for public sector. So anybody requiring ventilation in any public sector hospital would wind up going to Carl Hughesner. That still remains now. When we started in January, Carl Hughesner had 7 ventilators for the entire public health system. Today, those still remain at their ICU. We would now have 9 by the end of the day. So within a space of 4 or 5 months, you have doubled that. and there's the capacities, as I have said, to put more. Carlution will also be getting, or they got yesterday, 2 non-invasive ventilators. 2 non-invasive ventilators go to Orange Walk tomorrow. 2 remain in Belmopan, and 2 will go to Southern Regional Hospital. So every regional hospital would have 2 non-invasive ventilators. Again, I would want us to not be caught up in the fact that there is X amount of ventilators. As I have said, even if you have many, what is going to happen in terms of if you don't have the human resources to basically keep those ventilators? From my vantage point as a medical professional, I would want to make sure, first of all, I don't get COVID-19 so that I wouldn't have to worry about necessarily requiring a ventilator. What medications in order to assist with COVID-19 cases? Well, there's not a specific medication because it's a virus. What you treat are the signs and symptoms as they come along. Like the patient that I said in Corozal, that patient had pneumonia as a result of the viral infection. So they had bacterial pneumonia, and that patient was treated with double antibiotic, which would be what is used for pneumonia cases in that regard. Are there scores of tests first generation from whatever the index case was in San Pedro? Or are these people being detected in the second or third wave of the spread following the index case? Well, I'm assuming index case is going to be case number 57, or that's the first person we identified. What we did in contact tracing with this person is we managed to trace where the patient had been through in the previous 14 days, and then you go and look for the symptomatic cases. She had been in many places in those 14 days prior to that, but as I said, once we reviewed the data this weekend, 42% of the cases identified up until Sunday had one common, consistent situation, and that's a particular nightclub. So that's where we think along that time period is when the potential for infection would have been, because recall, this is now going to go 3.5 weeks since that happened. So that's, the infection period, and how people are becoming asymptomatic are just starting to show up here. There's no specific medication, because I know that people keep asking that. You go and review any literature, you will find out that there's one medication that's starting showing some kind of reduction in terms of morbidity and mortality, and that's a remdesivir. But other than that, there is no real specific medication for SARS-CoV-2. Even vaccines, I know that the Russian vaccine has been placed out there. Once I went back to review what the literature is in terms of the Russian vaccine, and then you realize that it has not gone through a phase 3 trial, which means it's not been tested in the wider population. There's no real published data as to how the phase 1 and phase 2 results came about. There's no scientific evidence that has been published to substantiate that. So the vast amount of the scientific community is skeptical as to how that will, what kind of impact it will have, if any, in terms of SARS-CoV-2. So as I said, in terms of the testing situation in San Pedro, case number 57 had 17 to 20 people that were positive. Up until Sunday, we have not gotten the full details of the cases from yesterday, where is their link, and the cases that are coming up today. Also understand that once you have community transmission, there is no sense in trying to link to which one of the 3 clusters, because you find what we call a cross-contamination. For example, one of the patients that we identified in Belmopan linked to a case in the north also appears to have had a link in San Pedro. So you can't say it's one specific cluster once you start to have community transmission. And for all practical purposes, what you try to do now is contain it, unless you're going to go and do research further into that. What would necessitate a countrywide lockdown? We don't make decisions. Ministry doesn't in terms of lockdowns. We make recommendations. I think one of the key items that we need to understand here is that even if you lock down for 2 weeks, because I think that's common, people are saying, we have to understand that after 2 weeks you're going to have to come back and face the same situation of potential cases still brewing around it. So I think what we need to start to internalize is the fact that every single person you meet on the street is a COVID-19 case. And I was telling the information officer this morning that maybe we should start ratcheting up that rhetoric to say, maybe I should start saying I am a COVID-19 case. So start thinking of that so that you can think of what levels of protection you would give others. So wherever you go, you have to assume maybe that you are the one that is going to infect others, so that we can start internalizing the message and start using the precautionary measures which now become part of our life. And that's the message we started to internalize when we were doing HIV, and this is perhaps because it's not going to go anywhere. I think that's the rhetoric that we need to now start saying to everybody. Do you have any young children infected? In San Pedro, one, not ill, but picked up as severely ill, then minor signs and symptoms, but picked up as part of the contact tracing that happened. The risk posed to toddlers, as we have said, the mortality rate associated to younger generations doesn't seem to be high, but any person that dies as a result of SARS-CoV-2 that you could potentially prevent, we cannot minimize numbers. They're not for the Belize context. That might be somewhere else outside of Belize. I would hate to think of us in terms of numbers. I would rather that we manage to all control this, and that we don't get caught up into potential of how many die, right? I know people are saying, well, maybe somebody else will have to go through that process so that we can start considering this seriously. I don't want us to go down that road. Any life that's hooked up to a ventilator is a concern. That's one of the first things I will always ask health teams across the country. Do you have anybody ill? Do you have anybody critically ill? Do you think anybody is going to progress from all the active cases we are following? The case in Dangriga is a female. She is pregnant. We have 2 pregnant females that are positive that we know of. Sorry, I have to know, the update is we have 3 hospitalized persons. 3, 2 at Carlucia and 1 in Northern Regional. That I just got before I came here. The patient in Dangriga is linked to the Santa Marta index case, and so that's how we picked her up. So contact tracing for that would have already started, and if you saw the infographic yesterday, some samples were run for Dangriga. What a percentage of asymptomatic cases versus mild and severe disease? We would have that data. I know that the infographic has specific information. It probably doesn't give you the value of everything that we would have. I think it's important that we say that. But we have a lot of other information that we can actually provide in terms of age groups, in terms of sex, geographic location. The information officer is telling me that, for example, we have the COVID-19 dashboard that is manned by the geographic information officer at health, that is now going to go on a live stream kind of situation. So what we have decided as an epidemiology unit is that maybe once a week, and you can understand that we don't have too many lots of staff at the EP unit to be giving you more data, but maybe once a week we can give more than the infographic in terms of geographic locations where they're coming from, age group, who was hospitalized, time to recovery, where they were swabbed, because that's another important thing. The fact that the infographic will show where you were swabbed. It doesn't necessarily mean where you live. I'll use the examples of Belmopan. One of the first cases here doesn't live here. Person works here, commutes to Belize City. One of the persons from Belmopan that was positive doesn't live here, commutes to Benque. And it's important that we specify that, because people want to know, does my community have? For all intents and purposes, assume that everybody in your community has it. You don't need to know. I mean, I can appreciate people wanting to know, but it doesn't mean that because you have a confirmed case in your community, your level of protection gears up. I think we have to, whatever we are gearing up for needs to be done whether you have a conform or non-conform case. Was K57 on the stated dates at the Allure nightclub? Yes, that's where it adds up. That's where we started to pick it up, and that's how you follow it. And I'm sure that eventually you can make all those linkages, but you understand that the amount of cases right now doesn't allow us to do that. And again, if you go back to the plan we had set in March, once you have community transmission, you are not going to be able to test everybody, and you're not going to be able to do contact tracing the traditional way. Take the big United States of America. They are not, I don't think even when they had 1 or 2, 3 cases, they were doing contact tracing the way we do contact tracing, relying on good public health measures. So we have to bear that in mind. Can you tell us the public places number 57 visited? Well, the way we went about doing this, because we did contact tracing for that, is all the places where she was and the level of contact was detailed, and that's how the persons who may have been at some level of exposure were contacted, people who had more than a casual contact then. So I think that was pretty much done. Is it true that Orange Walk district could be quarantined? I don't know that. I think that's always a possibility. Not only Orange Walk, really, it's every, you have to think it's every single community that can go through that. Since we had projected to open the international airport on August 14th, it's actually August 15th, are rapid tests available for Belizeans being repatriated? Is it for 24-hour test now available? I don't know which is a 24-hour test. I don't know that we had said we were going to use rapid tests on repatriated Belizeans. I think we had said we were always going to be using PCR testing, and that still remains for the flight this Friday. That is still what we intend to do, because remember, Belizeans are going to their community. Is there any natural remedy that can help alleviate symptoms once you get COVID and it's not yet critical? Not that I know of. You have to take your usual necessary precautions to avoid further deterioration. Eat healthy, drink healthy, do physical activity, and that should be happening right now. Those are immune boosters. Then maybe walking, running every morning is an immune booster. So maybe we should get into that habit. When a vaccine is developed, is our country negotiations to receive an amount of the vaccine? Through the Bajo Strategic Fund, yes. I actually got a call from one ambassador of a South American country earlier today asking specific queries as to what we were going to be doing in terms of vaccines once they're available. So I just, in the information I read this morning, 174 vaccines are in trial, -1, I guess, because of the Russian one. But just so you know, the amount of investigations that are happening out there in terms of trying to get the vaccine available. But you also, if you also read the cautionary note against trying to push for a vaccine so quickly, you run the risk of it not being fully effective, or it has too many secondary side effects. So we really have to ensure that they go through a phase 1, phase 2, and phase 3 approach for vaccines before they are released for wider use. While the MOH doesn't make the decision, will any level of lockdown be recommended by MOH? Yes, I think we have discussions. We have a direct line of communication to the NOC. My desk has to minister, and sometimes the Prime Minister has called asking for specific notes, and even indirectly we have had communication with the leader of the opposition was at times called, and his secretary has also called in terms of whenever they have any concern. People know that personally I have an open line of communication in terms of that, in trying to get everybody the information that's due. Then we don't keep back any information. Why not open testing to private labs? It is available to private, or maybe that they do testing. It's a question of capacity, as I understand it. PCR testing is not something that we have clamped down or said that people cannot do. If people have the ability to set up a PCR machine and whether they can run the test, I think that's an option, but nobody has been doing PCR testing. We have been doing PCR testing for the entities, I think, for the last 3 or 4 years. So I think that's a plus. I still see some Caribbean sister countries not doing PCR testing, but relying on sending it to CARFA once or twice a week. So I think there's value in understanding and appreciating the work that the lab does, which now brings me also to my other note, because I did say on the weekend we had up to 300 samples. Why weren't the 300 samples run? Again, if you go back to what we were doing 3-4 weeks ago, we had said we are doing testing Tuesdays and Fridays. For the most part, those samples were negative. So once you had a negative, you would have gotten the results 3-4 o'clock the afternoon, which is, as you would know, that's what we were trying to do, bring it out quickly. But once you have a positive sample, then that has to go through what's called confirmation process. So once you have more than one positive sample, you have 5, 10, 12, 15, then your process can be delayed. And also, before we publish the information, we need to make sure that all those positive cases have been alerted that there is a positive case, right? Because I can't go suddenly and say there's one person in Kikaka when the person in Kikaka has not been informed, even though I never say the name. I don't have access to names. Also, I think I need to specify that. People keep sending notes to the Office of Director Health, to my personal page, to my phone, asking for the names. I don't keep names. I only get the positives, and I want to know what their health status is, where they are, and how they are connected to others. That's done by the team behind. I don't keep the long list of names of people. That's the situation there. Is there community spread in Belmopan? We have not identified that. All cases identified in Belmopan have been linked to one particular case, and a couple linked to a case in the north. But no, we don't seem to have community spread in Belmopan. On what date was the purchase order for the SD Biosensor tests issued? Heard it was early this week. No, the SD Biosensor, the 5,000 kits are already in country. They are ready at the lab for the last 10 days. So that has been paid for maybe about 6 weeks ago, 7 weeks ago. Any idea for where the first case in Kikaka came from? No, that's still being traced. I do know that family members, immediate family members of that particular case were also having some signs and symptoms. So those people are being swabbed, and the contact tracing will have more people getting results. Any tests done from PG? Yes, that I saw that in the listing. The listing I have now has more than 400 samples pending to be processed, minus whatever comes out today. How long will it take to receive PCR test results if you are tested at the airport? We have now said to everybody, and again, go back to what we said in March, April, because they say that we always have to learn from where we have been. In March and April, we had gone from giving you results in 24 hours to saying 72 hours. The same applies now. Anticipate a minimum turnaround time of 72 hours to get your result. This is across the board, and this is, again, we are not going to rush the lab to just churn up results. We have to make sure that adequate protection is there for the lab, that they are not rushing and not taking necessary care, that there is no contamination of samples, that there is no spillage of samples. So when I called Mr. Chan, who is the person in charge of the lab, I made that clear to him. I don't want you to just churn up results because you want to go through that process. So they have started a rotation of staff at Central Medical Lab and expanded the testing hours, but it's still, the adequate mechanisms will have to be followed at all times. From a public health standpoint, if someone is a secondary or tertiary contact, should they be sent home from work or not? I don't think so. I think for all intents and purposes, when you're at work, You personally need to assume that, I just said it, that's a rhetoric perhaps, that I am positive. What mechanisms do I take to make sure nobody else gets infected? Or I have to assume that every single work colleague of mine is positive, because I meet with them. That's one capital mistake that's happening, and it's happening even with healthcare workers. Yeah, that because we all come together, we all see each other 8 hours a day, sometimes more, sometimes less, we assume that they are safe, and we let our guard down, we take our mask off, all of us in one little room, and then people call us later and say, oh, this person has turned out positive. My first question is, were you wearing a mask? Was the person wearing a mask? Was there physical distancing? Yeah, I had to send a memo to my staff at headquarters to say the wearing of a mask is mandatory. Avoid standing, having social gatherings in the common areas as much as you can, because you don't know where your staff went your colleagues went on the weekend, or what they do after 5 or before 8. So that we need to start getting that notion as we move along. Is COVID-19 antibody test available in Belize? When will the population be able to access this? We did get 5,000 antibody tests from the government of Taiwan, and we have gotten some of these kits donated to us as well. We have not used them. Eventually, I think that can be done, but we are not in the process of validating any of these for use. I mean, at the end of the day, I guess once you want to do research, or once you want to go and find out what's happening with the population, you can go and find out who has developed antibodies or not. Would you recommend that all those who are capable of working from home should do so? That's really up to you and your employer. I think some people can do that, but I think it's a discussion that you can have with your employer to minimize your exposure and exposure to the staff. I'm saying this because even BPOs, call centers, I had a chat with somebody who owns a call center earlier today, because we do have 2 cases linked. One is to a call center in Orange Walk. We don't know where the person got it from. And one is to a call center in Belize City. Both of those call centers, as I understand it, are closed for now. If yes, then this is what your recommendation be for teachers, as many of us are traveling long distance and taking public transportation to get to schools. Well, I don't know, if it depends. If you're required at school to be there physically, then I guess you would have to go there physically. Well, one teacher is also turned out to be positive, and that was before school started. But I think, you see, what I think needs to happen though is, if in point of fact we are going to be working from home, I know we had this discussion, then people really need to stay home, because the other notion is that some people are asked to work from home, but they still go out into the public, and level of exposure is still going to be there, even if you're using public transportation. So I guess if you are able to work from home, then you work really all from home. I think that's most of what I have. Maybe I'll just say a bit in do I need to say it in Spanish? Yeah, everything? In Spanish, it's gonna take 2 hours to say what I just said in... Bueno, solo para confirmar la cantidad de muestras que hemos tomado, y brevemente nada más, el lunes fueron 23 muestras positivas de 144, una en Corozal, 2 en Orange Walk, una en Kikaka, que es el primer caso positivo para Kikaka, que no tiene ningún vínculo con ningún otro caso previamente identificado. 5 en la ciudad de Belice, 4 de esos están vinculados con casos previos, y los demás en San Pedro. El martes hicieron 33 pruebas positivas, eso fue el día de ayer, con 84 muestras, un porcentaje de positividad casi del 40%. La mayoría de casos en San Pedro, un caso en Belmopan que está vinculado a casos previos, y un caso en la ciudad de Belice que está vinculado a un caso previo en Belmopan. Recordar que hasta ahora tenemos 10 trabajadores de salud infectados, 3 en el sector público, 1 en Carl Huschner y 6 en el sector privado, y un administrador. Lo que habíamos estado diciendo en español es que la mayor parte de la gente no se ha infectado en el sector o trabajando en el hospital, pues se han infectado fuera del hospital en casi todos los casos, pero son trabajadores de salud que por lo pronto no pueden trabajar. 2 pacientes hospitalizados, 3 personas, perdón, 2 en Carl Huschner, 1 en el Hospital Regional del Norte. Una de las personas está en terapia intensiva en Carl Huschner, es un caso crítico, que quizá va a requerir intubación en el transcurso de la tarde. En el caso de San Pedro ya no estamos haciendo búsqueda activa de todos los contactos porque ya hemos identificado que es transmisión comunitaria. Sí estamos buscando todavía casos vinculados a casos previos en el Orangewauk y Corozal, en Belmopan, donde aparezcan casos, pero no es el caso de San Pedro. De momento, las pruebas de PCR debemos de anticipar que la gente se va a tomar hasta 3 días en conseguir su resultado, y la gente que requiera pruebas de PCR para salir del país, los que estén estudiando, los que van a hacerse estudios médicos fuera del país, tienen que esperar. Vamos a tener un día específico en la semana que lo vamos a anunciar para decir qué día vamos a correr pruebas de PCR para los que salen del país. De repente toda la información que tenemos la estamos subiendo en tiempo real a los medios sociales que tenemos, en Facebook, de repente en Twitter, y esa es la información que tenemos. Por lo general no tenemos la información en español, quizá más adelante podamos hacerlo eso en tiempo más real. Sé que la página oficial del gobierno sí traduce los comunicados de prensa, así que esos los pueden accesar en las vías que ya sabemos. Eso es lo que tengo en resumen referente a los casos en todo el país. Y en el tema de ventiladores, que es un tema que de repente todo el mundo está preguntando, son 6 ventiladores en Carl Huschner y están consiguiendo 3 el día de hoy, y tal vez para el viernes ya van a tener otros 3 para tener un total de 12. Todos los hospitales regionales van a conseguir 2 ventiladores no invasivos, 2 en Orangewauk, 2 en Dangriga y 2 en Belmopan, y 2 para Carl Huschner. Así que para el fin de semana de repente tenemos ya 12 ventiladores invasivos en Carl Huschner y 2 no invasivos. Pero yo entiendo que la gente se preocupa por el problema de ventilación. Lo que yo le sugiero a la gente siempre es que no nos debemos de preocupar tanto el proceso de tener un ventilador o no, sino cómo evitar llegar a un caso de COVID para que no se requiera un ventilador. Porque una vez que un paciente requiere terapia intensiva o requiere un ventilador es porque el paciente está crítico y lo requiere. Pues ese paciente generalmente tiene un muy mal pronóstico. No necesariamente les va bien. De hecho, hay un alto índice de mortalidad una vez que te conectan a un ventilador. Eso es importante, yo creo, decirlo para que no nos quedemos conformes con la idea de que porque tenemos ventiladores ya podemos bajar la guardia. La otra situación con ventiladores es que aunque tuviéramos 15, 20, 30, 50 más, si no tienes el recurso humano, no tienes personal entrenado, y no es porque no los tuvieran por cuestión de fondos, simplemente no hay. Entonces eso no tener un hospital lleno de ventiladores si no tienes el personal no te sirve de mucho. Y esa es la realidad en la que vivimos aquí en Belice. Agradecerle a toda la gente que nos sigue apoyando, decirle a la gente que no pueden bajar, que porque si en su comunidad no existe o no hay ningún caso identificado, pueden asumir que no hay casos positivos. Yo creo que lo que tienen que pensar de ahora en adelante es que cualquier persona que ustedes encuentren en la calle tienen que asumir que tiene COVID-19, y la única forma como vamos a prevenirlos es tomando las medidas de prevención que todos ya sabemos. Es usar la mascarilla en forma adecuada, que te debe cubrir la nariz, la boca, usar el distanciamiento social o el distanciamiento físico, no social, de por lo menos 6 pies, el lavado de manos. Si una persona está enferma, se debe quedar en su casa, no debe andar en la calle contaminando el resto de la gente. Y si ustedes saben que estuvieron en contacto cercano con un caso positivo, lo tienen que reportar al sistema de salud que esté más cercano a ustedes. Un mensaje final quizá de mi parte es decirle que no podemos estar estigmatizando a la gente, porque de repente hemos conseguido muchos detalles de que la gente que habla, que viene, perdón, de San Pedro, los están estigmatizando, no les están tratando bien, que porque asumen que todo lo de San Pedro es positivo. En realidad no solo es San Pedro, cualquier comunidad donde venga la gente, ustedes tienen que asumir que es un caso potencial y manejarlo como tal. Así que eso es lo que hay que pedir conforme vayamos en este proceso. So I guess I can go back to English. I just have one final note and then I'll say it in Spanish. I noticed somebody said if I can do it in German, Garifuna, Maya. I can't even say it in Creole. So I can do English and Espanol, and that's about it. Hopefully when I have time I can learn Portuguese or French, but or maybe the other languages that they said. One other piece of news we have is that there's one batch that has come out today. It's confirmed now. 44 samples are positive. 40 of those are in San Pedro. The remainder 3 are in Belize City. They are linked to San Pedro cases. Only one of those is from a flu clinic in Belize City. So out of the 44 samples, out of 102 that just came out, 43 are at least linked to San Pedro. 40 are in the island of San Pedro. 3 are in Belize City, linked to San Pedro, to identified cases, and we had high suspicion of. It's only one that I have right now that came from a flu clinic that has no link whatsoever. En español, 44 de las 102 muestras que acaban de salir positivas para SARS-CoV-2, 40 en San Pedro, 3 vinculados a casos previos de San Pedro y 1 no vinculado que apareció en la clínica de flu que tenemos en la ciudad de Belice. Así que es lo que tenemos. And the final note is that they're expecting some 83 more samples in the next hour, 2 hours. So they're running 2 batches. Most of the samples that were processed yesterday and today are from San Pedro. So that's where you would have all that amount of cases. So we do know that's what we were anticipating was going to happen, simply because of the testing process and protocols that we have. So and we wait for the 83 samples that are coming up now. It's 44 out of 102. That's a positivity rate of 43.1%. I'm understanding that the samples that are coming up in the next 2 hours should be mostly from the northern part of the country and some other random samples that are taken as part of the routine testing processes across the country. So I have to go back and review this data now and the data, of course, of what comes up later on today. So that's the information I have. Thank you very much. Just do please continue to remain safe. Your prevention measures are here to stay. That those are not going to go anywhere. SARS-CoV-2, I'm sorry to say that, and I wish the science would tell me otherwise, and this is not my belief and my opinion, and you might not like the messenger, but you have to pay attention to the message. It is not going anywhere. We have to learn to live with it. The prevention measures that we have are set in place forever, or for the time being at least. Physical distancing, wearing a mask. If you're home, you have to stay. If you're ill, you have to stay home. So please continue to remain safe. Assume everybody you meet on the street is a SARS-CoV case, and hopefully we can start to really flatten this curve as we move along, because we now do have a curve. Thank you.